Hey friends, it's Dr. Batiri, and I want to spend a few moments to discuss with you headaches. Now, if you suffer from headaches, you're not alone. I just read a recent statistic and it said 45 million Americans suffer from at least 2 headache episodes per week. Now, that's a whole lot of headaches. And the problem is not so much the headache itself, but it's the fact that we're not correcting the cause of it. Most people are just taking ibuprofen or acetaminophen to quell the symptoms of the headache. And sure enough, within a certain period of time, the pain may go away, but you're not removing the cause of the problem. And the cause is only going to get worse over time. Now, what chiropractic does is something completely different. We look at the neck or the cervical spine to see where the vertebrae may be out of their normal position or not moving properly, and can cause neurological interference to the nerves that control the muscles around the head or the blood vessels around the head in the case of migraines. So I'm going to show you a couple of x-rays, a normal one and some that have an abnormal curve. And then I'm going to show you a few videos of the neck getting adjusted. And then we'll be back to see exactly what you can do in order to improve your health, get rid of the headaches, and be well. So hold on, here we go. Okay, so here's a picture of a normal cervical curve on an x-ray, and you can see that the spine is curved, and of course this is what else we want to see: a nice space between the first and second bone, and a nice space between the first bone and the skull. We need to have some spacing in there to allow movement. The x-ray I'm showing you over here is one of my patients who is a headache sufferer, and we can see that in this case the spine is beginning to reverse, and this vertebrae right here, which is the 5th cervical vertebrae, is kind of pushed back. The curve is going in the opposite direction, and there's hardly any space between the first bone and the skull, which is going to cause a compression of the neurological signals in that area. Okay, again, it should look something like this: a nice space, a nice curve, and in this case, no curve and a real compromised space in the upper part of the neck.
It's not like in the way. Okay, here we go. Let's get this in her neck. Let it roll my hand. Very good. Look at that. Yes. Your spine is moving. Drop it in my hand. Oh, fabulous. Nothing like a good laugh and getting adjusted.
Hopefully this video answered a few questions about your headaches. And of course, if you would like to make an appointment to come see me, I'd be glad to have a consultation and see if we can help you get rid of your headaches. God bless. This is Dr. Batiri. Hope to see you soon.